Okay, so my name is Simon Maskell. I'm a proud biokineticist. I work here in London, United Kingdom, and I welcome you all to the Movement is Medicine presentation series. This month, we're going to be discussing musculoskeletal management of injury, as well as the rehabilitation and prevention of injury. So I welcome you all on board. We've got members joining from all over the place, which is so great to see. So thank you so much for making the effort. A special thank you to Gabriela Haddo. Gabby and I work together in my practice. It's great to have you on call as always. And Rhubarb, thank you for joining us from Fulham Good Neighbours. And then to all of you, thank you so much for joining us. And let's get going with tonight's discussion. So I'm going to share my screen. I have got a lot of pictures that I'd like to discuss with you this evening. So let's get going. All right. So welcome to part 5.1 of 6. We're now into the 5th month of the Movement is Medicine series. Today we're discussing the aches and pains. We've got the online offering as well as the in-house offering at Fulham Good Neighbours. So this presentation is brought to you proudly by Fulham Good Neighbours and myself, and we are happy to share the knowledge that we can this evening. So I'm going to start off with our discussion about Fulham Good Neighbours. It's a wonderful charity in the area of Fulham in London, and they are an award-winning charity with multiple offerings for the disabled and the elderly of the Fulham area. And these are the offerings that come out of Fulham Good Neighbours. It is a wide diversity of services and many very interesting things for everyone to get involved with to take care of one another and prevent isolation. So please do get a hold of Fulham Good Neighbours if you're interested in any of these services. And it's great to have so many Fulham Good Neighbours members on call this evening as well. So I just want to take this opportunity to congratulate Fulham Good Neighbours on an international award that they've recently won for the work in partnership with Imperial College London and the Nubian Life for research on their Adopt a Garden projects presented at the Urban Transitions Global Summit in Barcelona. And this charity is hugely dynamic. A huge thank you to Jamie Hilton. He's the gentleman on the right-hand side of the photo. And yeah, he's the director of Fulham Good Neighbours and a really good person, but also a really good friend. So Jamie, thank you so much for having me on for the services that I do, as well as this Movement is Medicine series. So I would just like to welcome you all to the world of biokinetics. For those of you that do know about the world of biokinetics, I'm happy to explain it once more. For those of you that are new to the world of biokinetics, welcome. And we are a profession that deals with the science of human movement. We have scientifically supported clinical exercise prescription programs for the prevention, management, rehabilitation, treatment of patients with injury or with musculoskeletal injury or chronic disease, and for those wanting to improve their performance, whether that be sporting or normal activities of daily living. So this profession originated in South Africa. It was officially pronounced as biokinetics in 1983. This profession is a 4-year university degree. Some of the universities are presenting the course over 3+1, meaning an honors, and then the other universities are presenting it as a 4-year course. We then have 1 year of full internship where we are employed by other biokineticists within the field to accumulate practical hours of training. We are a full medical profession that is registered with the Health Professionals Council of South Africa in South Africa, obviously, and that is the equivalent of the Healthcare Professionals Council here in the United Kingdom. In South Africa, we are covered by all medical insurance companies, and that is the goal for myself and my colleagues here within the UK, is to gain some recognition from the medical insurance. We do have a global footprint. We have extended ourselves through Australia, New Zealand, Namibia, UAE, Germany, and now the UK. And it's really exciting to announce that the Biokinetics Association of the United Kingdom is registered with the HMRC and Companies House. We are registered as a CIC, so a community interest company, and that occurred in May of 2021. So we are working towards getting the profession recognized, and please do visit the Biokinetics Association website at biokinetics.uk to see where my colleagues are based in the UK and where you could get biokinetics treatment. So the scope of practice, as stipulated by the Health Professionals Council in South Africa, is a healthcare profession concerned with optimizing movement and function throughout the human lifespan, using preventative, rehabilitative, and performance-enhancing exercise modalities. And we do span across the full range of exercise requirements, from musculoskeletal, which we will be discussing this evening, to chronic diseases, neurological, rheumatological, and respiratory conditions, cardiac conditions, wellness and prevention, which is a huge thing and hugely required across the world, sporting performance enhancement, and in the special populations groups, of which the physical and mental disability, mental health, and older population groups are of huge interest to me. So we form part of a multidisciplinary team, and we are healthcare professionals that work in the medical industry with consultants, specialists, GPs, physios, chiros, osteos, psychologists, dietitians, podiatrists, OTs, and we are proud of the space in which we work, and we definitely encourage more cross-referral amongst these other professions. So the strengths for biokinetics is we have extensive training in exercise rehabilitation and prevention. We have extensive practical experience. We look at the patient as a whole. We don't just treat a knee, for example. We'll treat a whole patient that presents with a knee injury. We have strong sports medicine training. We have a great understanding of injury and prevention for disease, as well as the pathophysiology of recovery. We are experts in exercise prescription for rehabilitation prevention, strong biomechanical skills, and our scope scans across from injury and disease to right up to performance enhancement for athletes. So this evening, we will be discussing musculoskeletal conditions. I will be taking you through a basic anatomy lesson. Some of it is pretty intense and in-depth, but that is what I would like to also expose, just because the biokineticist is as well trained as we are, and we do understand all medical as well as musculoskeletal conditions in great depth. We will be discussing injury prevention, exercise prescription and rehabilitation from a biokinetics perspective, rehabilitation, as well as my biokinetics clinic, and then I'll leave you with some take-home messages. So let's get into the musculoskeletal system. We know that it is hugely complicated, so I'm going to try and keep it as simple and as easy to follow as possible, and I'm happy to answer questions at the end of the talk. So the musculoskeletal system is to maintain, it's important that we maintain strength throughout our lifespan because it's an essential component for human health. It comprises of bones, joints, muscles, tendons, ligaments, as well as connective tissue. And the number of total bones within an adult, I won't be testing anyone this evening. You're welcome to read along over there, but we're looking at 206 to 213 bones in the human skeleton at adult age. And the function is to support and structure the body to provide the ability for movement and muscle attachment, for protection of our brains and very important organs underneath that skull, as well as our rib cages and throughout our pelvis. And it's important for the formation of blood cells, storage of fats and minerals. In respiration, the rib cage obviously widens to allow for greater airflow into the lungs. And then for hearing, as we all know, there are bones within our ears as well. So when we look at the types of bones in the musculoskeletal system, we have flat bones, short bones, long bones, irregular bones like the vertebra, and then the sesamoid, such as the patella, or the bones underneath our feet, which are actually not connected to other bones, but are only held by tendons and cartilage. So interesting, and I hope that you find this topic interesting too. So when we look at the joints, there are approximately 360 joints in the adult body. This is where bone meets bone, and it functions to facilitate movement. There are many structures within a joint, and that is why it is so susceptible to injury. And if you look at the pictures on the right-hand side, you will see that the top one reveals the hip degeneration on the right-hand side, where you see the circled components of this particular X-ray is the ball and socket joint of the hip that shows all the white, which is showing the degeneration. And on the left-hand side of that particular picture at the top, you can see that this patient has had a hip replacement, whereby there's a ball and socket that gets plunged into the femur, held in position, and we are less painful and a lot more mobile after joint replacement. The bottom picture shows a knee joint, and you can see on the right-hand side, there is significant narrowing of that space between the two bones, revealing the degeneration or arthritis, and that can be seen on the left-hand side of that particular picture as well. So there are different joints within the system. There are fibrous joints, cartilaginous joints, and synovial joints. And I will be focusing on the synovial joints for this evening's talk, just because that is where we often have further injury. And this is where there is a capsule that encases the joint that is filled by synovial fluid. And why that is important is the condition of rheumatoid arthritis often attacks the synovial fluid within the synovial joints. So when we look at these joints, we'll start from head down to pelvis. And sorry, yeah, that's cool. So the pivot joint is right up at the neck. The gliding joints are at neck level as well. We then look at the ball and socket joint, which is sitting at the shoulder, as well as the hip joint, the hinge joint, which is at the elbow and the knee joint, the condyloid joint, which is at the wrist, and then the saddle joint, which is at the thumb, just for interest's sake. So when we look at muscles, we are looking at over 600 muscles within the adult body. They are involved with all functioning. They are controlled by the central nervous system. So there is a nerve that is initiating muscle contraction, and muscles thrive with healthy eating and exercise. The types of muscles that we have in the body are cardiac, so the heart muscle, smooth muscle, which is in the endothelium, and then skeletal muscle. And I mentioned fast and slow twitch muscle fibers. The fast twitch muscle fibers are for short, fast bursts of movement, and the slower twitch muscle fibers, which all muscles hold, are for more endurance-based movement. So exercise that can go on for a prolonged period of time. The function of muscles is to provide mobility and movement, stability to the system, as well as for maintained posture. They are important for circulation. The smooth muscle is important for circulation of blood throughout the system. Respiration, the diaphragm needs to contract to assist with breathing. Digestion and urination, childbirth, and then vision, which we know we have really important muscles behind the eye that assist with vision. So when we look at ligaments, there are over 900 ligaments within the system. These are the connective tissue that connects bone to bone for joint stability. And that is the difference between a ligament and a tendon. A ligament connects bone to bone, and a tendon connects muscle to bone, which we'll see in the next slide. So as you can see, this is a foot. This is the lateral ankle, so the outside of the ankle. And you can see that these white pieces are the ligaments. And these are the technical names for them, which I will not go through right now. But this is where we have a lateral ankle sprain, and these are the ligaments that can be affected. Great. So we now look at tendons, and as I've said, they connect muscle to bone. They assist with movement. In this particular picture, we can see that the biceps muscle is connected to bone by the thick fibrous tissue that is extremely strong. And when the muscle contracts, the connective points between the insertion and the origin then contract towards one another, and that assists with movement of the joint. So it's really interesting. The only unfortunate thing are these particular structures are susceptible to injury just because we do many overuse type activities, and we do have poor biomechanics of movement, which I'll get into later, which reveals weakness or overuse, and thus causing something called a tendinopathy, which is an injury to the tendon. Great. So when we look at other connective tissues, we're looking at the cartilage, the bursas, the fat pads, the joint capsule, and the fascia. And these are things that may have come to your mind over time. And I'm just going to go through a couple of them. We look at cartilage, we're looking at the meniscus between the knee joints. So this is the femur, this is the tibia, so the top bone and the bottom bone of the knee. And this particular substance is there. It's a really hardy substance, but it's there for shock absorption. And unfortunately, with rotational movements and through degeneration, we can get meniscal tears, which are difficult to treat. They are treated conservatively, but they can also require more invasive treatments. So this is just looking downwards on the knee joint, and you can see that there's a tear there that will require further treatment. We're then also looking at the bursa, and this is the trochanteric bursa that we're looking at. This is the ball and socket joint, and the bursa is there. It's a little sac filled with fluid that actually prevents friction between muscle, tendon, and bone to allow for good, smooth movement of muscle. And if the bursa is being pressed up against the bone between the muscle due to tightness or inflexibility or poor biomechanics, then the bursa can become inflamed. And these are some incredibly uncomfortable conditions to treat, but they can be treated through the magic of biokinetics and exercise rehabilitation. So when we look further into musculoskeletal conditions, there is approximately 1.71 billion people across the planet that are suffering from musculoskeletal conditions. So it is widely spread. And this is according to the World Health Organization, which is just a random number when you think about it, but it just shows you the prevalence of musculoskeletal conditions. And we really need to do something about them because they have the unfortunate reality of decreasing our lifespan because we decrease the amount of movement we do. So when we look at the types of injuries that can occur, we do see that acute and sudden injury can occur. It's sudden and severe. It's like an accident or a fall, or unfortunately car crashes or sporting injuries. We then also look at chronic conditions, which are long-lasting conditions due to overuse. Some musculoskeletal pain is localized, so it is in one particular area, and some may affect the entire body, which we speak of systemic conditions such as fibromyalgia and rheumatoid arthritis and things like that, which can affect more than one joint and more than one area of the body. So when we look at children and adolescents, they present differently and they have different types of injuries in relation to adults and the older population. You can understand that the children may present with growth-related conditions. So if we look at something like this, which is a degenerative hip, you're bound to see that in the older population groups, and you're not bound to see that in children. We do see other conditions within children, such as Sever's disease and Osgood-Schlatter's disease, whereby the growth plates are being injured. However, different population groups present with different injuries. We then also speak of the active versus the sedentary population groups. You can understand that a sporting person has a much greater risk of ACL injury, so an anterior cruciate knee ligament injury, rather than a sedentary person who we may be looking at a degenerative spine type condition or decreased muscle stability and joint stability due to lack of use. So all injuries present slightly differently. I hope to be able to touch on something that is of interest to you, but with this topic being so widespread, it is difficult to cover all bases. However, that is what the intention of this particular talk is. So when we look at the types of injuries that can occur, we have bone injuries such as fractures, stress fractures due to overuse, tumors, which you don't want to miss. We've then got joint pain. So we've got stiffness and inflammation, such as rheumatoid arthritis, degeneration, joint replacements, meniscus tears, labrum tears. The labrum is the shock-absorbing cartilage within the shoulder and the hip, and then dislocations, which are from trauma. So when we look at muscle pain and muscle injury, we look at muscle spasms, cramps, strains, tears in tendons, usually overuse injuries. However, there can also be severe and acute injuries, and ligaments usually come from trauma and an actual event. So when we look at these pictures, we look at the Achilles tendon. The Achilles tendon attaches at the heel bone or the calcaneus. It's a long, strong tendon that is connects to the calf muscles, the gastrocnemius and the soleus. And this is a tendon that does get injured due to the amount of requirement that we put through it, as well as the amount of weight that that particular tendon is required to carry. And again, biokinetics has some great techniques on how we can treat these tendons that you may not have seen or heard of in the past, and we'd be happy to treat you in clinic. So when we look at the degenerative disc disorder, this is a longer or older population group injury, whereby these degenerative changes to the actual vertebra, which decreases mobility of the spine and increases our risk of injury. So we look at a normal spacing between on the left-hand side of the disc, and then there's a narrowing of space on the right-hand picture. And you can imagine that that would decrease mobility, increase, unfortunately, pain, and decrease one's activity levels, which makes them at risk of further comorbidities and disease due to decreased activity. Great. So then we look at the shoulder joint. The shoulder joint is a ball and socket joint. It's the humerus bone that sits in the glenoid, and that is a very mobile joint because there's lots of mobility that a shoulder can do, and that unfortunately puts it at risk of injury. So if we look then at shoulder dislocation, like we see in rugby, the actual head of the humerus comes out of the socket and does need to be placed back into position. Unfortunately, there is often soft tissue damage that needs fair rehabilitation after a shoulder dislocation, and sometimes more invasive treatment is required. But I'm just going to bring your attention back to this particular setup of the shoulder girdle. We've got a very thin bone here called the clavicle. And unfortunately, when we do fall, we sometimes fall on the point of our shoulder, which closes the space between our shoulder and our chest. And that can unfortunately fracture the clavicle. So the clavicle is one of the bones that does get frequently fractured with falls. However, through acute treatment and then exercise rehabilitation, we can get back to full function. But as I say, the shoulder joint is a very mobile joint, therefore good biomechanics and really well-balanced exercise prescription is important to try and maintain the biomechanics of this particular joint to prevent injury. And that takes me to the shoulder impingement. And this is an injury that swimmers get, but unfortunately, this is an injury that the older population gets as well, whereby the musculature holding the shoulder joint in position doesn't hold quite as well as it should, and the shoulder joint moves up into the acromion process, causing grinding on the particular tendons, and that does cause pain. There are many ways of treating that, but from a biokinetics perspective, we try and get good back muscle strength, good chest muscle release or flexibility to allow the space between the acromion process and these tendons to be greater, therefore less friction, therefore less pain, and ultimately trying to save degeneration of that particular tendon. So I hope this is of interest. I know it isn't always great to see injury, but it does give you a better idea of exactly what a biokineticist is trained to do. So our treatment options, this is where the biokineticist sits. In the conservative treatment, we use exercise in the management of musculoskeletal injury. We are well trained in this space. The physiotherapist would then use manual therapy. There's many technological therapies that now exist. For example, shockwave therapy, which is readily available and widely used. So technology is definitely taking over in this space as well. We use bracing and orthotics to try and maintain some external forces to prevent joints from being out of alignment, and also to maintain a good biomechanical position. Injection therapy, widely used by the consultants, very effectively, depending on the severity of the case. And then in some cases, surgery is required. So if we look on the bottom here, when we look at the foot, many of you may have heard of something called plantar fasciitis. It is extremely painful underside of your foot. It is where the fascia attaches to the heel bone down towards the toes. And because of us walking continuously through on our feet, it stretches this particular fascia, which can cause quite a lot of discomfort. So we do then require exercise rehabilitative techniques to try and release the fascia from the underside of the foot. There are other manual therapy techniques which we use. We use flexibility higher up the chain. So we don't only focus on the foot, we're focusing on flexibility of calf, flexibility of hamstring to try and release the amount of tension on the underside of the foot. This is a case that would not require surgical intervention. There is, in some cases, plantar fasciitis that causes a heel spur, which is a piece of bone that starts to pull from the actual calcaneus, which in some cases does require surgical intervention. But we can all respect that with the left-hand side picture, there is no type of exercise that will fix this. And we encourage our colleagues in orthopedic surgery to do a good job in fixating these bones back together. So these are the fibular bone, the smaller bone of the lower ankle, and this is the tibia. And you can see that that does require surgical intervention. All right, so when we speak of the causes of injury, as I said, there are acute events such as a fall, an accident, or an injury, which can cause instant pain. And there are overuse injuries such as a plumber or an electrician that is constantly working with their hands. They may then end up with elbow tendon injuries. We've spoken a lot about poor posture and poor biomechanics that causes injury. This is exactly where the biokineticist fits. Poor technique, that can be lifting techniques, that can be carrying techniques, that can be techniques in the gym or exercising techniques. Deconditioning. Deconditioning is a big one. Our bodies are made to move, and the less they move, the weaker, unfortunately, they become. So we're trying to keep muscle nice and strong, nice and responsive to movement, so that we do decrease our risk of injury. When we look at sporting related injuries, we look at poor technique in a gym, improper or poor training practices. We look at wearing improper sports gear, the being in poor health condition, improper warm-up or stretching, and unfortunately, bad luck can also play a massive role. So when we hear of this thing called the ACL injury, which I'm sure you've all heard of, it is a common sports-related injury. There are two very powerful and very, very strong ligaments within the knee joint, and they're right internal of the knee joint. So there's the anterior cruciate ligament and the posterior cruciate ligament. And if the joint is hit at forces, it sometimes gets a rotational force with the foot on the floor, as well as then the movement of the body moving in a different direction. And that can cause tearing of this particular ligament. That, in most cases, does respond well to surgery. There are cases whereby surgery was not required because it does depend on what the patient's requirements are from their normal activities of daily living. However, we've got to be respectful of the fact that if there isn't great joint stability, that can cause greater risk of the articulating surfaces moving in directions that causes greater degeneration to those articulating surfaces. So sometimes surgery is a really good option for prevention of secondary injury in that nature. I hope that all makes sense, but I'm sure it does for all. Good. So when we look then at prevention of injury, we do understand that prevention is better than cure. We all hear that repeatedly. And I have to mention, there's a professor that I used to work with, Professor Wayne Dermond, and he said to me, Simon, there are two populations in the group, one with back pain and one that's going to get it. And that just puts it in perspective. We're trying our best to prevent injury from occurring, but we can't prevent everything from occurring from time to time. We do encourage a good, healthy lifestyle to try and reduce our risk of injury, but sometimes injury will occur. It's just how we manage it. So when we look at prevention of injury, the important thing is that we do maintain strength and mobility, so strength of muscles and mobility of joints. We move frequently, try not to get into a sedentary lifestyle. If you do sit for prolonged periods of time, which I will get to in the later slide, it is important that you get up within every half an hour and definitely within every hour to maintain good muscle activation, but also to prevent muscle from fatiguing for long periods of time by being in the same position for a length of time. So grade your progression of exercise to prepare for your demands. So as you can see in this picture, he's going hiking up mountains. It would be illogical of him not to build up to going hiking up mountains, rather because that would then reduce the risk of injury, rather than actually just putting on your shoes and going for a walk that is 2 hours long, build it up from 20 minutes at a time, for example. Okay, so wear the correct clothing and footwear. Ergonomics, which we'll discuss later on in this particular section, prevention of injury, that's the correct work setup. Seek exercise advice, and I really do encourage this. We all do want to move, we all do want to move well, but do seek exercise advice to try and gain some supplementary exercise programs that add value to your already exercising life. So for example, if you are a tennis player, please make sure that you are getting some advice on how you can maintain good knee strength, good hip strength, and good lower back strength, rather than just playing tennis twice a week. On the other days of the week, you're also supplementing with biokinetics-based exercise treatments, so specific strengthening. We use preventative measures. So to prevent overuse injuries, such as I return ourselves to the plumber or the electrician, please make sure that you're taking care of your elbows and your shoulders after a heavy day's work. You may even want to ice these particular areas, regardless of whether you have pain or not, or use heat into, back spasms to try and reduce the risk of further degeneration of structures, and keeping yourself really prevented from incurring injury. And then implementing accurate training techniques, whether that's in the gym or building up to a longer walk, or literally just doing, the normal activities of daily living. It's really important that we train the way in which our bodies move so that we can achieve tasks without putting ourselves at risk of injury. So that takes me to this slide, which, when we look at posture, we all unfortunately are starting to look a little bit like tortoises because of what our lifestyles demand. And that is using our phones, using screens, all things like that, rather than the good old days where we used to actually have conversations with people. We do it now on phones. So our postures are changing. Our demand to sit and work for prolonged periods of time is changing. So we really need to try and use exercise to maintain our good, strong postures to prevent injury. When we're seated, this doesn't look like the most comfortable seated position to be in whilst on the couch. But what this illustrates is to just not get too comfortable for too long, because we know that that decreases muscle activation and puts us at risk of deconditioning of those particular muscles if we're in a poor seated position for a prolonged period of time. And sleep, we do spend a prolonged period of time sleeping, so it is an important area to try and maintain good biomechanical position to reduce the amount of tension on certain areas of our bodies, particularly the lumbar spine. So the one that I encourage the most is to be lying on your side. If your shoulder can withstand that, lying on your side with a pillow between your knees to prevent a rotational force on your pelvis. Okay, then we look at the working population group who does spend a lot of time staring at a screen. You can see on the left-hand side, there will be greater tensions into certain areas, the neck, the back, the lower back. So we've got to really try and get into better postural positions whilst working for prolonged periods of time. And this is when we are taking care of one's ergonomics. So it's pretty much the positioning whilst working. And again, I encourage, standing up more frequently. Half an hour is a good length of time, definitely an hour to try and stand and do some stretches or at least some walk around the offices. I like these pictures just because of the strange faces on this particular guy's face. The illustrations on the left-hand side is pretty much saying, maintain good posture, especially whilst carrying something. Try and carry this something closer to your body rather than away from you, and do keep your head underneath the line of your pelvis right into the feet. And then when we're lifting, you hear this so many times before, but hopefully these illustrations can leave the information that we require to prevent injury. But please bend your knees, keep your back nice and flat before you actually lift something heavy. And the other thing I will say is think. Please make sure we're thinking before we're moving. And that carries me to our next slide, whereby in our kitchens, for example, we'll move things from one surface to another by rotating our pelvis or rotating our spine. But actually, to prevent injury, if we moved our feet to move one thing from one counter to another, you're reducing the amount of forces going through your spine, therefore reducing your risk of injury and degenerative change. Great. So when we look at exercise rehabilitation from a biokineticist perspective, we are specialists in this space, and I really am proud to be a biokineticist, as you hear. I'm really passionate about the work that I do, but not only is it a job for me, it's more than that. It's a lot of fulfillment to get patients obviously feeling better, doing more with their lives, and then reducing the risk of other comorbidities, so other diseases from occurring. due to good musculoskeletal rehabilitation. So our aims in the early stage is to protect the injured area and manage pain. In the intermediate stages of exercise rehabilitation, we address the strength and proprioception. So proprioception is where your brain sees your body in space, such as balancing on one leg or throwing a ball against the wall, for example. You're trying to manage where your brain sees your joints in space for good muscular control and joint biomechanics. In the late stage, we're then looking at improved agility, coordination, and muscle endurance. So exercise prescription should be seen as an adjunct to pharmaceutical management. I'm not a great believer in medication. However, medication is required for certain medical conditions, which I fully respect, and I always encourage to stick to doctor's orders. However, we do want to use exercise to reduce the medication requirements. Use a holistic approach to improve overall morbidity. So we're trying to encourage exercise rehabilitation so that we can then regain great function to prevent risk of other conditions from occurring. Integrate purposeful movement into our daily schedule, whether it is activities of daily living, ADL, or return to sport or return to play. We're trying to get activities within our exercise program that are similar, repeated, and therefore we make those stronger. Good. So when we look at biokinetics treatment, I am going to go through this in fair detail just so that you understand exactly what the biokineticist does. But we then go through the documentation, consent to treatments. We do a risk screening because we're not just treating a knee, as I say, we are treating a person that comes along with a knee injury. So we look at your cardiovascular or coronary artery disease risk factors, as well as your wellness. We get medical clearance for exercise from other medical professionals of your case if required. We look at your medical history as an overall. We then look at your injury history to make it more specific. And then we look at your previous exercise history so that we get a better understanding of exactly what the patient endures in your normal life as to why the injury may have occurred. We look at the mechanism of injury, and then we look at ways in which we could implement a good, healthy lifestyle and healthy plan to be able to reduce the pain, but also then have prolonged recovery. So in the assessment, we then look at the postural assessment. We look at the gait analysis, so how one walks, how one moves. We then look at the strength, flexibility, and joint range of motion. We use special tests that they called in musculoskeletal management to diagnose the severity of certain medical conditions, as well as gain direction on how we're going to approach the rehabilitation program. We do a functional movement screening. We make contact with all other medical professionals within the management of your case so that we have greater understanding and then make further referral when required. And patient education is a huge part of my job, and I emphasize that. The more we understand what we're going through and how we can make it better, the more chance of us actually engaging in good lifestyle habits and good exercise habits to try and reduce pain, but also prolong a good, healthy lifespan. We then look at our biokinetics treatment. We focus on muscle strength and flexibility. We look at joint ranges of motion and how those can improve. We look at your balance and proprioception, your motor skills, whether they are fine motor skills or gross motor skills. So fine meaning smaller movements with digits, or gross motor skills are bigger movements such as getting up and down from a chair. We bring functional exercises to your exercise program to improve your biomechanics. Example, the shoulder. We know that poor biomechanics is the greatest risk for shoulder impingement. If we can get better biomechanics of that particular shoulder joint, we reduce the risk of your injury. Midline training and center of gravity. So using both sides evenly, being aware of where your center of gravity might be, because if you don't understand the differences of where your center of gravity is, your risk of falling becomes greater. And we're always trying to reduce risk of falls. So we then bring in activity-specific or sport-specific training to build you up and progress you to the requirements of what your normal day would look like. Where necessary, activity modification is really important, such as if a walker really has very painful feet, we then go and use water-based exercise or hydrotherapy to reduce the amount of weight bearing going through those particular feet. We're still keeping up with good cardiovascular wellness, but without putting pressures into those patellas, into those plantar fascias, which then could cause further pain. And then lifestyle modification. So eating healthy, reducing our fat composition, of our bodies to reduce the amount of weight that we're carrying, because we understand that that does cause greater risk on joints. So the modalities of treatments within biokinetics, we use body weight exercises, we use accessories such as these TheraBands, or TheraBands in this particular picture. We then use gym-based exercise. All of these modalities are not always required. We do find ourselves being really adaptable to our patients' environments to try and make sure that we get exercises done. They don't always have to be in the perfect environment to be effective. We use technology. There's certain things like neuromuscular electrical stimulation. There's really exciting assessment tools coming out. So we use technology to try and enhance recovery. And then we use cardiovascular. So the walking, cycling, arm ergometer, hydrotherapy, we increase heart rate so that we're taking care of hearts, brains, and lungs. Good. So the practical considerations within biokinetics treatment is each case is treated individually. So we understand that, yes, there might be 2 ankle strains, but these 2 ankle strains have come from very different mechanisms of injury. One may have been a fall, and the other one may have been, from a sporting injury. So there's very different mechanisms of injury, and each case is treated individually. So we consider the comorbidities, so the other underlying conditions, and vice versa. So if a patient presents with diabetes, for example, for exercise rehabilitation, these patients often present with a musculoskeletal injury as well. So we really are treating patients as humans and beloved humans rather than just the next knee or the next foot. And we really do treat holistically. We have to consider secondary musculoskeletal injuries. So if you do have back pain that is causing inhibition of nerve down your one side, we do understand that that could make you susceptible to injury of that particular joint or musculature down that right side. So if we speak of sciatica, there's impingement of nerve at lumbar spine region. We then have decreased muscle activation through the one side. That particular musculature is at greater risk of injury. So we are very conscious of that to try and balance things out whilst rehabilitating the original injury. So re-injury is one of the biggest indicators, injury is one of the biggest indicators for re-injury. And rehabilitation is important. If you are out of pain, that doesn't mean that you're completely rehabilitated. We do need to use exercise to continue to get those imbalances improved. So rehabilitation programs should really be taken right to the end. They shouldn't be stopped once you're out of pain. Patients' mental well-being is always considered with injury because we all understand how debilitating injury is. And if we can take care of one's mental well-being and psychology, we can decrease the influence of that particular injury, which then gives us greater chance of a speedier recovery. And then we're always conscious of referral to a multidisciplinary team for further investigation of an injury that we are not exactly getting the best improvement with. We can't see into patient joints and muscles, so we need to get imaging, and then would refer for specialized treatments when required. And my biggest job is to maintain hope and provide motivation for my patients so that we know we can get some improvement, if not get this injury completely cured. Good. So prehabilitation. Prehabilitation is a concept that some of you might not know of. Prehabilitation is a really important concept to me because we sit in a position whereby, especially in the UK, we'll be told that we do need requirements or treatment on a knee joint for, let's say, example, a knee replacement. But between the time that we are now told we need a knee replacement and the knee replacement actually occurring, maybe many months. So what are we doing in that particular time? And that is where the biokineticist fits perfectly. We prescribe exercise for exercise prehabilitation for surgery, so that when the patient does need to go in for surgery, they have actually been performing the exercises, strengthening up that muscle, and then obviously enhancing recovery after the surgery occurs. And this is a space where the consultants are working really hard to try and get patients faster recovery through exercise rehabilitation before surgery. And this particular article that was presented or published in The Guardian on the 1st of August 2022 indicates everything about prehabilitation. We have had the Health Service Journal report that more than 1 million people are waiting months and sometimes years, which is up to 120 weeks in this article, for out-of-hospital care and community-based health services. These conditions span from back pain to foot problems to hearing loss. So I do respect that about half of that particular 1 million people do require care for musculoskeletal conditions. And if you are waiting up to 120 weeks for musculoskeletal care, you can understand that the risk of that injury becoming so much worse is great, but also your risk of having other diseases occur because of reduced activity, because you are unable to do so, becomes so much greater. And this is where the biokineticist needs to add a lot of value within the healthcare system in the United Kingdom to try and take care of these patients. There are abundant numbers of patients that are needing care, but at this stage, we are in the private sector. So when we look at the following one, there are a record 6.6 million people currently waiting for care in hospital. So this is surgical procedures or minor surgical procedures, such as joint replacements, which is obviously fairly surgical, but cataract removal. So I do understand that the 6.6 million is not the total number of joint requirements, musculoskeletal case requirements, but there is a huge number of patients that can do well with prehabilitation. So I return myself to prehabilitation. It is exercise before surgery to enhance recovery after surgery. Good. So when we look at our biokinetics clinic, myself and Gabriela Haddo are very well experienced in biokinetics. We have clinics in London, in Southwest London and Central London, and we're really proud to bring valve technologies to our clinical practice. At the moment, we are working with 2 to 4 of these particular systems, but what these systems are all about is giving instant feedback on certain things like muscle strength or other things like movement analysis. So when I speak of doing an assessment with biokinetics assessment, we don't always have objective measures of these particular deficiencies and where the particular requirements are. So now we're getting objective measures on where the deficits might lie and how we can better design our exercise rehabilitation programs. The human track system is brilliant for postural assessment, for biomechanical movement assessment. So we're really proud to be introducing greater technology into our clinical practice. So we're available in Fulham, in Until, which is a new business that's developed in central London, in Soho and Liverpool Street. We provide face-to-face consultations. We provide online consultations, as well as the chair-based exercise class at Fulham Good Neighbours, which is now online as well as in person. So if you require any further information on biokinetics in my clinic, please do visit the musculoskeletal.com website, and please do get in contact if you feel that I can assist. So the professional memberships that we are associated to in the United Kingdom, proudly the Biokinetics Association of the United Kingdom. I won't go through all of them, but it gives you a great idea of where biokinetics is headed. One that I'm really proud of is the British Association of Sports and Exercise Medicine, and then internationally with the Health Professionals Council of South Africa, and we are looking at enhancing our professional memberships into Clinical Exercise Physiology UK. So at Fulham Good Neighbours, I'm really proud to deliver the exercise classes. We have worked through the pandemic online. We have worked in-house pre-pandemic. We now are sitting at a combination of in-house and online treatments, which it's still the highlight of my week. It always will be. I absolutely love these classes. And if you would like to get involved, please do make contact with myself or Fulham Good Neighbours with regards to exercise classes for over 65 online and in-house. Good. So our take-home messages. I hope I'm doing okay for time. Yeah, we're right on 7. So when we look at our take-home messages, I just want to remind you that biokinetics is a reputable medical profession. Exercise is an important part of any treatment plan for a patient with arthritis or any other musculoskeletal problem. Biokinetics can enhance patient treatment, reduce pain, increase their mobility, mitigate against comorbidities, improve their quality of life, and lead to fewer hospital referrals. I do encourage to seek medical assistance quickly after feeling pain musculoskeletally for rehabilitation. Rehabilitation is extremely important for patient recovery, but also prevention of further injury and secondary injury. Please do speak to our biokineticist at the Biokinetics Association in the United Kingdom for exercise advice, and accurate exercise prescription reduces hospital admissions, reduces drug costs, referrals, appointments, and visits, therefore reducing the strain on the NHS. So I do really appreciate your time. Thank you so much for joining this evening. Our next talk is in person on the 28th of November. That is a repeat of tonight's talk. And then next month, we're looking at aging gracefully on the 5th of October, on the 5th of December online, and then on the 12th of December in person. So there are my acknowledgements and references. If you would like to read further, please do get in contact